We have is Jess here? Yeah.
Everyone's here. Sorry, I was just on mute. I didn't realize. So we've begun, and I think people are filtering in. Thank you so much, everyone, for joining us today. Just make sure we're recording.
Yeah, you are.
And I'm on my screen. Thanks, Lisa. Great, and welcome everyone to today's webinar, Naloxone Busting the Myth. This session is part of the Canadian Red Cross Fall 2024 webinar series on opioid harm reduction for Indigenous peoples. Our National Risk Reduction and Resilience team hosts virtual learning events throughout the year to share knowledge and ideas for communities, families, and individuals to make their communities safer and stronger. We will share the registration web pages with you in the chat momentarily. The International Federation of Red Cross and Red Crescent Societies has seen fundamental principles, which we also honor in Canada. Interestingly, these principles align with Indigenous peoples of Canada's 7 sacred teachings. Across Turtle Island, these are also known as the grandfather teachings of wisdom, love, respect, bravery, honesty, humility, and truth. And we just have a few housekeeping items to share before we begin. You can scan the QR code on your screen to visit our registration page for the rest of our webinars in this learning series. And you can also access our webinar recordings on our YouTube channel, which we will also share with you in the chat. Today's webinar is recorded and will be sent to all registrants. The session is in English, but closed captioning into French is also available. Just click the closed captioning button in your Zoom control panel at the bottom of your screen. And today we will also be using interactive features such as polls and the chat box, and it's completely voluntary to participate in any of our activities. We will have a quick question and answer period at the end of our presentation, so please leave your questions in the Q&A box in the control panel at the bottom of your screen. We will also have an optional roundtable where we will move over to a separate Zoom meeting link. So you have an opportunity to engage with our facilitators with your camera and your mics and any of your questions that you may have in addition. So we will share that link with you at the end of the session if you would like to join us. And we also have a feedback survey that will launch in your browser once we exit the webinar, and we appreciate your input. And finally, if you have any questions or comments, please email us at rrr@redcross.ca. And without further ado, I would now like to pass this on to my colleague, Deotitate, Lisa Peterson, to open us up today with an opening prayer. Thank you so much.
Nyawa goa April, nyawa. I will say a few words the words that come before else. As a Haudenosaunee woman, I always encourage setting out intentions before we embark on subjects that are difficult to discuss. It is a way of being grateful. I will say it in Ganyak Mohawk, and then provide a loose translation in English. So kanjoko zo da hosios kanigariwesa negadi ahon the gariwa dekwa going ahead sto. Agwego askan de dwa wenuni ne agwani gorda dana detinuera done ungwesua togadi na yotu ne agwani gorda. Agwego askan de dwa wenuni ne agwani gorda dana detinuera done yukini stahanzi unzade togadi na yotu ne agwani gorda. Agwego aska an de dwa wenuni ne agwani gorda dana detinuera done ganigarunyo togadi na yotu ne agwani gorda. Agwego aska an dito wahwen uni ne agwani gorda dano dietinura dune ohunde su'a dano otera su'a togadi na yo dune agwani gorda. Agwego aska an dito wahwen uni ne agwani gorda dano dietinura dune onunkwa su'a togadi na yo dune agwani gorda. Agwego aska an dito wahwen uni ne agwani gorda dano dietinura dune kayon tosera oni ne John Hekwa togadi na yo dune agwani gorda. Agwego askan de dwahwen nuni ne gwani gorda dano dietinuera dune gahi su'a togadi na yot dune gwani gorda. Agwego askan de dwahwen nuni ne gwani gorda dano dietinuera dune gundirio togadi na yot dune gwani gorda. Agwego askan de dwahwen nuni ne gwani gorda dano dietinuera dune ogwire su'a dano garhunda su'a togadi na yot dune gwani gorda. Agwego askan de wahwen nuni ne agwani gorda dano detinuera dune odinunga su'a togadi na yot dune agwani gorda. Agwego askan de wa nuni ne gwani gura dano de tinura dune yoki soto gora di wera stanura radigona resta togadi na yot ne gwani gura. Agwego askan de wa nuni ne gwani gura dano de tinura dune gayeri ni gawarage togadi na yot ne gwani gura. Agwego askan de wa nuni ne gwani gura dano that said the one wera dune sunqa dia anjaneka garakwa. Togadi na yot ne gwani gura. Agwego askan de wa nuni ne gwani gura dano de tinura dune yoki sota asantaneka garakwa. Togadi na yot ne gwani gura. Agwego askan de wa nuni ne gwani gura dano de tinura dune yo jisto korunyu ne garuhiade. Togadi na yot ne gwani gura. Agwego askan de wa nuni ne gwani gura dano de sido no wera dune sunkwaya dizu. Togadi na yot ne gwani gura. Onagadi Tony Ore yate wani harho doga tena zayon gwani gura izagane ana zazewakwa da gunhado e gadi ni otohakne gwani gura. So these are the words basically that we say before we start anything, before all else. In Mohawk and Haudenosaunee culture, we say versions of this to say thanks and to set our intentions. We give thanks to the natural world and all of the components that make up our world. We begin with humans and we end with our great natural being or the great natural energy. So let this be our intention for today. Nyawa Goa.
Thank you so much, Lisa. That was beautiful and very much appreciated. I'd like to say good morning or afternoon, depending on where you are in this great country. But my name is Kristen Jordan, and I'm a Cree-Irish woman who's coming to you from a small village called Purdue in Saskatchewan. I accepted a position with the Red Cross in May of 2024 with the National Indigenous Programs Health Promotion Team. I am a mother of two beautiful children, a daughter, an auntie, and a friend. I'm a foster mom for about 12 local charities that house our critters until they find their forever homes. And I have been given the honor of presenting the work completed by the Indigenous Programs team on opioid harm reduction to your wonderful audience today. I will now pass it back over to my co-presenter, Lisa.
Yeah, Kristen. Sego zeo gwego deo zizate Lisa Peterson yojats. Waxkarewege ganawagane diwaganu. Hello, everybody. I wish you great peace today. My name is Deo Zizate Lisa Peterson. I am a Bear Clan woman from the Mohawk community of Ganawage, which is located in what you know as Quebec. I am a mom, I am a dada, and I'm a very, very proud Haudenosaunee woman. I have been with the Canadian Red Cross for a little bit over 4 years, and I am a member of the Community Wellness and Protection Team, which is part of the Help Desk for Indigenous Peoples. So happy to be here to offer some insight into this very important topic that's near and dear to my heart. Now I'm going to pass this on to my very beautiful friend and team member, Jessica.
Thank you so much, Deozidate. So hi, everyone. Good morning or good afternoon, wherever you're tuning in from. I'm just going to say, as we're introducing ourselves, we invite you to do the same in the chat if you feel so inclined. My name is Jessica, or most people call me Jess, and I grew up on the south coast of Labrador, and I now call Fort McMurray, which is on Treaty 8 territory in northern Alberta, home. I'm a sister, a daughter, a granddaughter, an auntie, a volunteer, a friend, a partner, and more importantly, a dog mom. I've spent most of my working life in the helping field, wearing different hats and different capacities, and I now work on our community wellness and protection team with the Canadian Red Cross. So I'm looking forward to this conversation today on what is a very important topic to me, both professionally and personally. So with that, I'll just say that I'm grateful that so many of you have taken the time to join us today, and I'll pass it over to my lovely colleague, LA.
Thanks, Jessica. Hi, my name is Leslie Ann, but most people call me LA. You'll find me in my new home, in my new small village, also in Saskatchewan, with my husband of about 8 days, just outside of Saskatoon in Treaty 6 territory. I was born on the other side of Treaty 6 territory in Edmonton. I am the Senior Manager of Injury Prevention, and I have been with Red Cross as a staff person for about 13 years. I have been teaching Red Cross programs for a little over 30 years when I started as a swim instructor teaching our fantastic color program. My family is primarily from England, Ireland, and the Ukraine historically, and we are now pretty much based here within Saskatchewan and Alberta. So I thank you, and I'm really happy to be here today. Thank you for all of you for joining us, and really happy to be co-presenting with Kristen, Deozizate, and Jessica as well. So let's pass it over to Kristen and get ourselves going.
We are thrilled to have you join us for today's information webinar. Thank you for taking the time to be here. We're delighted to have you join us today from across Canada. Today, we'll be discussing opiate harm reduction and services provided by the National Indigenous Programs team to address this crisis. Please feel free to use the chat to ask questions or share your thoughts throughout the presentation. Following today's webinar, there'll be a 30-minute optional roundtable discussion. Don't hesitate to jot down any questions you may have. Let's get started. During our time today, we will focus on what naloxone is, as well as some common myths associated with naloxone. We will also learn where to access and how to use Canadian Red Cross opioid harm reduction resources. Finally, we will learn where to find services and programming for support around opiate harm reduction. Overall, we would like you to have increased knowledge of opioid harm reduction resources, tools, and support provided by our team at the Indigenous Peoples Help Desk. We would also like you to come away with genuine curiosity and renewed sense of empathy and support for those struggling with opioid misuse. I would like to share what we are speaking about in this webinar series in the interest of making this space as safe as possible for those who join us on this journey. When we speak about the opioid crisis and harm reduction, naturally, we will be speaking about topics like depression, grief, loss, trauma, and ultimately addiction, and all that encompasses this experience. We understand that while these discussions are important, they are also deeply personal, vulnerable, and sensitive topics that can bring up complicated emotions, especially for those of us who've had firsthand experiences with these subjects. Please take a moment to check in with yourself. Ask, am I in a good headspace to hear this conversation? Who can I reach out to for support if I need it? We've attached a few national resources that are easily accessible to you via phone, email, or text, whatever is most comfortable for you. Please do not hesitate to use these resources if needed. April will be dropping these helplines in the chat. We would also like to issue a disclaimer that the content we share with you today is for informational and educational purposes only. It is not intended to take the place of medical or professional advice. We encourage you to do your own research about local laws and policies that govern harm reduction in your community. If you need immediate assistance or support, please contact your local EMS or police. Please note that our team is here to offer information and foster connections within your community. If you require a more in-depth support, we will encourage you to connect with the Indigenous Peoples Help Desk. Our advisors can connect you to the appropriate resources, refer you to the relevant Canadian Red Cross department, provide a customized provincial toolkit, or guide you towards the most suitable support based on your specific needs. Thank you for allowing us to assist you. Please don't hesitate to reach out for more personal guidance. I would now like to pass over to my co-presenter, Leslie Ann. Thank you.
Thanks, Kristen. This is an opportunity. We do love to have our audience get involved, so it's not just us talking at a bunch folks on the other side of the computer. So please do feel free to use the chat. And we have 3 questions for you. And you can go ahead and I'll give some space after I've asked each question. The first question is have you taken CPR or naloxone training? You can just put yes or no's if you feel comfortable to go ahead and share. That would be fantastic. Just how many, get a gauge of who has taken some CPR or naloxone training. I see lots of yeses. There's definitely a few no's. Well, hopefully for those of you who have not taken it, hopefully this will be the starting of that for you. And for those who have, there's always something new to learn as we take courses, which is why we have recertifications as well. So the second question is, do you know of any safe consumption sites in your community or near your community if there isn't one in your community? Okay, there's a lot more no's in this situation, and that's not surprising. Because safe consumption sites have a lot of, there's some challenges definitely with those, and no matter what the readiness is. And then our last question for you in the chat is, do you or your community have access to substance use resources? Mm-hmm. And do you know where to easily find those resources? So there's a lot of yeses, which is fantastic news that there is that accessibility for that. I see there's a couple that has say a minimal or that it might be a little bit further away. Again, hopefully this is a great resource for you or a starting point to access some additional resources and toolkits if you don't have them. And if you do have them, hopefully a great supplement as well. So thank you so much for participating in the chat and for engaging with our questions. We are going to actually move into a little bit about what is naloxone. What is it? What does it do? So we're going to first cover the basics of it. What is it? How does it work? Naloxone, you may also know it as Narcan. It is a life-saving medication that rapidly reverses the effects of opioid poisoning until the person can receive professional medical care. Now, naloxone is what's called an opioid antagonist, which just means that it blocks the effects of opioids in the brain. It can be administered both as an injection or as a nasal spray. So folks may have seen both versions of it. Naloxone works by attaching to the same receptors in the brain that the opioids bind to. And what that does is when the naloxone attaches to those receptors, it blocks their effects for the opioids. Opioids like heroin or fentanyl can slow or stop breathing by overwhelming those receptors. When someone is experiencing an opioid poisoning, one of the main risk factors of accidental death is that their breathing slows down or actually even stops because the opioids bind to those receptors in areas of the brain responsible for breathing. This binding reduces the ability of the brain to send signals to the body to breathe, which is what leads to that respiratory depression. When naloxone is given, it quickly pushes the opioids essentially off those receptors, takes their place, which temporarily reverses those effects. This restores normal breathing and consciousness in someone who is experiencing an opioid poisoning. However, those effects only last about 30 to 90 minutes. It is temporary, so medical help is still needed. In addition to the slower breathing, actually there's other signs that may indicate an opioid poisoning as well. Things to look out for might be sounds of choking or snoring. This might actually indicate that there is an airway obstruction. There can also be extreme drowsiness or unresponsiveness. So that person may be unconscious. They may be unable to wake up, even if you're shouting their name or you're trying to shake them gently. They may also have pale or clammy skin or a bluish tint you might notice around their lips or fingertips, their fingernails in particular, which is that kind of reduction of oxygen in the body as a result of the reduced breathing or slowed down breathing. Their pupils may also get this, what's called a pinpoint pupil look. So where the black part of your eyes get to be very, very, very small. You can also look for clues in the room and surroundings around you as well, including needles, could be pill bottles, all of which may cause you to suspect an opioid poisoning. Naloxone works very quickly. It tends to work within about 2 to 5 minutes after administration. The exact time and how quick it works depends on many factors. The method of administration is one. So naloxone actually works faster when it's injected. So the intramuscular, the syringes and needles that you would use versus the nasal sprays or intravenously. The amount of the opioids in the body will also impact how fast it works. The higher doses of opioids in the body or the stronger opioids like fentanyl may require more time to work or additional doses of naloxone as well. If there is no response after about 2 to 3 minutes, a second dose can be given, but in any case, emergency medical help should always be called. During our first session in the opioid harm reduction webinar series, we shared information about virtual provincial and territorial toolkits developed by a team at Canadian Red Cross. April will share the link to our first webinar in the chat. Toolkits include items related to naloxone access, training and education, emergency opioid poisoning response and preparedness, and other resources that may be regionally acceptable or applicable. April will now share those links in the Alberta, Manitoba, and Ontario toolkits. There is also a QR code on your screen that you can scan to go directly to the Manitoba toolkit. Our team is finalizing toolkits for all provinces and territories. And these plans, we have plans to have these available by the end of 2024. So do please contact the Indigenous Peoples Help Desk for more information about this resource as they become available. So I will now pass you back over to Kristen, who will talk a little bit more about myths and stigma.
Thank you so much, Ellie. Now that we have shared a definition of naloxone, we will move over to covering common myths and stigmas around naloxone use. Let's take a moment first to define what we mean by myth and stigma. Myths are false beliefs or ideas that are widely held but not based on fact or evidence. They often arise from misunderstanding, cultural influences, or misinformation. They can persist even when being disproven. For example, the myth that naloxone encourages drug use is not supported by any scientific evidence. Stigma. Stigma refers to negative attitudes, stereotypes, or discrimination towards a person or group based on certain characteristics, behaviors, or conditions. Stigma can lead to shame, isolation, and barriers to seek treatment or help. For instance, stigma around drug use may prevent individuals from accessing life-saving naloxone or substance use treatment. Why is it so important to bust the myths and stigmas around naloxone? First of all, it saves lives. Misinformation and stigma can prevent people from carrying or using naloxone, reducing access to medication that can save lives during an opioid poisoning. It encourages access. Breaking down myths helps normalize naloxone use, making it more acceptable for individuals, families, and communities to have it readily available. It supports public health. Addressing stigma promotes harm reduction strategies, which are essential in combating the opioid crisis and preventing unnecessary deaths. It reduces fear and shame. Educating people helps combat the shame associated with opioid use and naloxone, encouraging individuals to seek help and support without judgment. It empowers community. By spreading facts, communities are better equipped to respond to poisoning and advocate for policies that improve naloxone availability. It fosters recovery opportunities. Naloxone provides individuals with a second chance at life, allowing them to pursue treatment and recovery, dispelling myths, ensuring that more people receive this opportunity. It combats misinformation. Addressing false beliefs ensures that policies and communities' attitudes are guided by science and compassion, not fear or prejudice. Breaking myths and stigma around naloxone creates an environment where saving lives and addressing substance use is seen as a collective responsibility. Now we are going to have an interactive activity with you, our audience. I'm going to read off some statements about naloxone. After each statement, you will see a poll pop up on your screen with the answers myth or fact. When you see the poll, please click your answer. As we go along, we will share the results of the poll for each question. Then we will reveal whether the statement is a myth or a fact. Let's begin. Number 1, naloxone encourages drug use. Do you think this is a myth or a fact? The poll is popping up on your screen now. We will give everyone 20 seconds to put in your answer. All right, so April will now share the results of this poll. I see that 98% of you believe it's a myth and 2% of you believe it is a fact. The correct answer is this is a myth. Some people believe that having naloxone available might encourage riskier drug use. However, studies show that access to naloxone does not increase drug use, but instead saves lives. Statement number 2. Naloxone is easy to use and designed for everyone, including bystanders, to administer. The poll should be popping up on your screen now. April will share the results of this poll when our 20 seconds is up. Wow, 100% of you said it was a fact. And it is a fact. Naloxone is designed to be used by anyone, including family, friends, and bystanders. Nasal sprays like Narcan come with simple instructions for non-medical use. Statement number 3. Naloxone is dangerous to administer to someone who is not experiencing opioid poisoning. The poll should be popping up on your screen now. April will share the results of this poll. I see that 82% of you feel like the statement is a myth, and 18% of you feel like this statement is a fact. The correct answer is this is a myth. Naloxone is not dangerous to individuals who are not experiencing opioid poisoning. If you suspect an opioid poisoning, it is recommended to administer naloxone and call for emergency help. Here are some other common misconceptions about naloxone. It works on all drug poisoning. Naloxone is effective only for opioid poisoning. For example, heroin and fentanyl. It does not reverse the poisoning caused by other substances like alcohol or cocaine. Number 2, once it is given, poisoning is over. Naloxone temporarily reverses the opioid effects, but it is not suitable for medical care. Its effects will wear off in 30 to 90 minutes, and the person may become poisoned again. People who receive naloxone will be fine afterwards. Even after naloxone use, withdrawal symptoms can linger or effects of the overdose can occur. So immediate follow-up medical care is critical. Thank you. I will now pass it over to Lisa and Jessica to cover busting common myths.
Nyawa, 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 Kristen. Thank you so very much. So let's go over some common stigmas around Narcan and naloxone use. People who overdose don't deserve help. This is a myth. Everyone deserves help. People who struggle with substances are trying to conquer an illness. It may not be as blatantly obvious as someone who has a visible disability, However, those who struggle with substance use are indeed fighting for their lives. As humans, we would not turn our backs on someone who is in a wheelchair, is missing limbs, or who is visibly sick with cancer. And addiction to substances are the same. Society has placed a stigma on those who struggle with addictions, or some may know it as poisoning. And I am encouraged about the discussions like the one that we are having today, because maybe it will give those listening something to think about and maybe alter the way they perceive those with the illness of addiction. As heart workers and as human beings, we should always place effort to preserve life. Someone may overdose 8 or 10 times, and that may be the time that they reach out for help. Nobody asks to be ill. Nobody asks to be sick. Understanding addiction and understanding a situation from a trauma-informed place gives those who are healthy a different understanding and may allow us the opportunity to help when someone needs our help. Passing this on over to the beautiful and intelligent Jessica.
Well, aren't you just so kind? Thank you, Deozadate. So the next statement reads, carrying naloxone means you're a drug user. And as we sort of, share our thoughts around these statements, if you're comfortable, I invite you to also use the chat to share where you think the stigma lies in these statements as well, because yeah, we'd love to hear from you too. So for me, I think the belief that carrying naloxone means you're a drug user is not only incorrect, but I believe it's also very harmful. So as we just learned about, naloxone is a life-saving medication and it's used to reverse opioid overdoses or poisonings. And so anyone can carry it, whether they use opioids or not. And I think people who choose to carry naloxone, I believe, do so out of concern and responsibility. I think about parents or family members or community workers who might encounter someone at risk of an overdose or poisoning on a daily basis. And so I think carrying naloxone is more of a sign, I guess, of compassion or preparedness, not an endorsement of drug use. We know that overdoses can happen to anyone, regardless of their drug use. And naloxone, I think, is a crucial tool in preventing death and saving lives. So I believe that the focus should be more on reducing the stigma around opioid use and recognizing that harm reduction does save lives rather than making assumptions, I guess, making assumptions about a person's relationship with substances based on their willingness to carry naloxone. All right, so I think the next one reads, what does it read? It says, using naloxone enables drug use. So I think the statement, I guess, a huge misconception that overlooks the true purpose of the medication. Again, naloxone is a life-saving tool. It is part of this broader harm reduction strategy. And that strategy is aimed specifically at keeping people alive and safe while they work through their challenging relationship with substance use. So far from enabling drug use, naloxone offers people, another chance at life, allowing them to seek help, treatment, and even recovery when they're ready. And so the goal is to protect lives and provide sort of, I guess, a bridge to recovery, not to support ongoing substance use. Harm reduction recognizes that people who use drugs are still people and they deserve respect, safety, and support. And naloxone, I believe, is an essential part of that support. And I think I'm going to hand it over to you, Deozadate, for our next statement.
Oh, thanks, Jessica. Substance use is a choice, so overdoses are self-inflicted. This is definitely a myth. Nobody chooses to be sick, plain and simple. At the root of illness is always an underlying issue, such as mental illness, circumstances like poverty, trauma, genetics, physical, mental, and other abuses. And in addition, we do not know a person's history, and the substance use may be their way of trying to escape from their reality. Also, opioids are a pain medication. Many have used them when visiting a dentist or after surgery. Not all stories of drug use are illegal. We do not know a person's story or history until we ask questions and until we can offer them some support. Nobody chooses to be sick. Anything else that you would like to add, Jessica?
Yeah, thanks. I absolutely agree with what you said, and I would, say that the thought that substance use is a choice, and that poisonings are self-inflicted, is again harmful and, in my opinion, also oversimplified. So, for a second, if I put like my more of a clinical hat on here and say that substance use disorder, is a medical condition and it's a complex medical condition. So it's influenced, by so many factors, like you mentioned, Deosidate, genetics, trauma, so many other things. So it's not simply a matter of willpower or, I guess, a conscious decision to engage in harmful behavior, because people struggling with substance use often feel trapped by things that are beyond their control. And they often don't intend to harm themselves when using substances, but they're actually trying to relieve a physical or an emotional pain. And poisonings are tragic outcomes of this medical condition, not the result of a choice. So many people who overdose don't plan on taking a lethal dose, but instead are exposed to contaminated or more stronger than expected substances. And this does drastically increase the risk of an overdose or poisoning. And I think blaming individuals for their circumstances really just gives us permission to ignore some of the, I think, broader social and psychological factors that are really at play. So yeah, I guess I think instead of placing blame and adding to the stigma, if we viewed substance use as, excuse me, a health issue, it really allows us to focus more on the prevention, the education, and the harm reduction strategies so that we can work with people to regain control over their lives and to live fully. And I think we just have one more to go. Yeah, so people who poison themselves will just do it again. So this a common misconception, I suppose, is definitely stigmatizing, yes, but I think also fails, again, as I mentioned earlier, to recognize the complexities of substance use disorder and also the process of recovery. So we know that substance use disorder is a chronic medical condition, and it's not, I guess, a moral failing, as some people call it. And so many people with substance use disorder or opioid use disorder are committed to the recovery, even if they experience setbacks along the way. So what I always say is that recovery is nonlinear. It's going to look different for each and every one of us. And the reality is that relapses can be part of the journey. But that doesn't mean that someone doesn't want to get better or that they're destined to keep using. So I think it's important to understand that people in recovery face so many challenges, environmental factors, mental health issues, lack of support, and lack of resources, and the list just goes on. However, I happen to know that with right treatment and support systems, people do recover and lead fulfilling lives. So I guess the idea that someone will, just do it again overlooks the real work and commitment people in recovery make each and every single day. I think offering, compassion, support, and effective treatment options is really far more productive than kind of perpetuating the stigma of, yeah, well, they're just going to do it again. So I think with that, I am going to hand it back over to you, Kristen.
Thank you so much for that, Lisa and Jessica. Now I have two questions for the both of you. The first one is, how can you personally help reduce stigma around opioid use and support harm reduction efforts? Start with Lisa.
Yeah, Kristen. So for myself, I'm always going to encourage people to treat everyone with the same respect, the same dignity, and the grace that we would like to be treated with. I encourage people to become educated about the issues and the topic of substances. Be aware that anyone at any time can become addicted to something and not limited to just substances. It can also be food or shopping, for example. Understand and recognize that Western medicine largely treats illness with legal medications, and that those medications, although prescribed, are medicines that we can become addicted to. We as a society often have a misconception that as long as a medication is prescribed by a doctor, that we are safe from poisoning. And I just want to say that in Canada, 43.9% of adults over 55 has used a prescription opioid. And that's a large part of the population that are experiencing poisonings. In care facilities, the staff are trained in how to use naloxone and Narcan. And the reason, poisoning and overdoses can happen even when you are using the medications the way you are prescribed. And those things do happen. Jessica?
Yeah, what a great question. I guess I think for me personally, there are a few ways, I guess. The first that comes to mind is about providing accurate information and education kind of whenever and wherever I have the space to do that. And so for me, keeping up to date with the accurate information is important. And I also always say that, we don't know what we don't know, right? And so when I hear someone maybe pass on information around addiction or opioid use or naloxone, I always am sure to lead that conversation with empathy while also providing the accurate information. And I think when we focus on understanding that, substance use disorder is not a bad thing or a wrong thing, it really helps kind of shift our perspective towards, yeah, like a more compassionate view of people who use opioids. Um, I guess I also try to normalize these conversations. So whether it is at work or I'm having coffee with a friend or I'm talking with my family, I really aim to just create a space that's open for that dialogue. And I think this helps reduce some of the discomfort and the fear that often surrounds the topic of opioids, harm reduction, overdosing. And I think just addiction or substance use disorder in general. And also counteracting that in misinformation when I hear it's like one that I hear sometimes is opioid use is always linked to criminal behavior or people who use opioids can't recover. And for me, like the truth is that I will always choose to highlight the stories of recovery and success because I do know that it happens, and I just really love to promote that hope. I think I'm going back over to you, Kristen.
Thank you so much for those thoughtful responses. My second question is, how can we create safer spaces for people who use drugs, both physically and emotionally? Lisa?
Yeah, Kristen. So, as Ungwahumwa people, as Indigenous people, and as people who provide support and help to Ungwahumwa Indigenous people, we know the history of harm. We're aware of it. We have heard about residential school. We know that many have been stripped of our languages, our culture, and have moved from their traditional way of living and their traditional territories. This has caused harm to our peoples, and it was manifested in many ways. We see it in homelessness. We see an influx of diabetes, poverty, and definitely we see people struggling with substances. When we have a foundational understanding of this history of harm of our people, this creates a safe place. This idea of being trauma informed and aware, along with the idea of harm reduction, creates a safe space. And for myself, I have lived on a reserve all my life. I see the struggle our people have to exist. Those who struggle deserve love. They deserve to be helped when they allow us. And even if they don't allow us, we still love them and they deserve to be loved regardless. And promotion of opioid harm reduction philosophies is so very important. Creating spaces that support traditional ways of being while healing is promotion of a safe space. And making sure everyone has access to Narcan, Naloxone, and knows what to do if they come across someone who may have had substance poisoning. When the Western ideologies and traditional Indigenous ideologies work together, I believe that this creates the ultimate space for healing and helping. Back to you, Jessica.
Yeah, thanks, Date, for really, I guess, highlighting that creating safe spaces is really about choice. So allowing me, us, everyone to have a say in what our healing looks like. And so you just gave really beautiful ways to create safe spaces. And I don't have much to add, I guess, just to quickly say that creating physically and emotionally safer spaces for people who use drugs really does involve, I think, cultivating environments or spaces that prioritize wellness while showing respect and ensuring that there's access to chosen support or resources, all while also contributing to reducing stigma and harm. And I think we do this, yeah, by promoting the non-judgmental attitudes, advocating for resources and support, and just in general raising more awareness when we get the opportunity. And I guess I can add that by having these spaces available, we don't only provide immediate safety, but we also contribute to longer term positive outcomes as well. So I encourage you all who's listening today as well to reflect on these questions and ask yourself, yeah, how can I help reduce this stigma and help create these safe spaces in my community or workplace or yeah, wherever they're needed. So thanks for asking those really thoughtful questions, Kristen, and I'll just hand it back over to you.
Thank you so much, Lisa and Jessica. Those were amazing insights, and I'm sure had a deep impact on our audience. So, in conclusion, here are some key takeaway facts about naloxone. It saves lives without increasing risk of drug use. It only reverses opioid poisoning, not poisoning from other substances like alcohol. Naloxone is designed for anyone, including bystanders, to utilize. Naloxone is safe and has no effect on people without opioids in their system. Naloxone effects are temporary. You must call medical care. Naloxone provides a second chance for individuals to seek treatment and recover. Now, just a quick closing check-in. What is one action you feel confident taking today after this webinar to support someone who may be struggling with opioid use? Please leave your comments in the chat. Oh, someone's proudly going to carry a kit with me. Be kind. I love that. Create safe spaces. Empathy. Empathy for sure. Access to culture, ceremony, and medicine. Yes. These are wonderful, absolutely wonderful responses. Now, as we move in towards the Q&A, just a quick note that our team is here to offer information and foster connections within your community. If you require more in-depth support, we encourage you to connect with the Indigenous Peoples Help Desk. Our advisors can connect you to the most appropriate resources, refer you to the relevant Canadian Red Cross departments, provide customized provincial toolkits, or guide you towards the most suitable support based on your specific needs. Thank you for allowing us to assist you, and please don't hesitate to reach out for more personal guidance. Finally, we want to thank everyone for joining us today, and I will pass this back over to April.
Thank you so much, Lisa, Kristen, and Jessica, for your wonderful presentation today. So much information and insights, and I think the audience is really appreciating everything that was shared today. And so this is the third webinar of our Indigenous Peoples webinar series on opioid harm reduction. And if you are able to join us for our final webinar, it's taking place on Thursday, December 12th, 1 to 2 p.m. Eastern Standard, with another roundtable at 2 to 2:30 p.m. Eastern Standard afterwards. And the topic is learning from Indigenous communities. And so you can register for our final webinar for this series at the QR code, and we will drop the link in the chat one more time in case you didn't catch it the first time. And we will also be moving into our optional roundtable that is again going to be on a separate Zoom link. I will share that with you momentarily. Here it is. So we won't be moving into this immediately. We have 8 minutes for any questions that the audience has in case you can't make our roundtable. So now is the perfect time to drop your questions for our fantastic facilitators in the chat. And we will be monitoring for any questions.
April, I know there was a question earlier, I think from Nate, about peer and social pressures. And I don't know if there's any answers from the rest of the group. I know that's something that my team is working on a little bit, is finding out more ways of, because a lot of our opioid harm reduction work is for children and youth for our group. So pressure is very, peer pressure and social pressures is very, very relevant there for sure. And so that is something that we are looking at providing some resources for too. So those will be kind of coming in the future a little bit as well. So I may not answer your question right now, Nate, but there will be some resources coming around that, more targeted for youth. However, a lot of that can probably still transfer over and translate to also adult pressures and things like that as well.
Yeah, and I want to add to that. I'm always an advocate for traditional healing, your own personal healing journey. And I think that from personal experience, that when you are doing your work and when you're doing your personal healing work, whatever that may look like for you, that peer kind of pressure that you're going to experience, it may be positive instead of negative, encouraging you to try things like that, or that are a little bit nefarious. When you are doing your work, you attract healthier people too. So I just wanted to add that.
That's great. Thank you so much. And I'm just scanning the chat here. Lots of thank yous for sure. Someone asks, is meth an opioid? Yeah, we're getting shakes of the head, so no. There are any more questions from the chat? Now's your last chance.
Sorry, I would just like to speak to that. Is meth an opioid? And someone answered back, no, meth is not an opioid. And yes, meth is not an opioid. So, however, I would like to fall back on something we had said during this webinar, that naloxone is safe to be used with people in all situations. What we're finding, and I can speak to this as someone who's an 18-year veteran social worker, is that we're often finding lots of drugs mixed right now. That's happening. And so sometimes you might assume that someone has had a certain drug, but it could be a drug that was mixed with others. So again, please keep in mind that naloxone is safe to use. It will not have an effect on someone who's used meth and only meth. However, if that meth was mixed with a opioid, it could potentially save a life.
Thank you, Kristen.
There was a question around, does Red Cross offer free first aid training for volunteers? There's no simple straight answer to that, actually. A little bit depends on where you are in the country. On the whole, often first aid training isn't necessarily provided for free, but opportunities do come up sometimes if there's another training happening internally. So my recommendation would be is for any of Red Cross volunteers on the webinar right now would be to connect back with your current contact, whoever that may be in your region, whether it's your emergency management coordinator, or if it's your mental health and psychosocial support coordinator, or if it's the volunteer engagement team, connecting with your local Red Cross branch that you kind of work with already with your volunteer engagement, and ask them what their policies are around first aid training and how that gets covered or provided, and various opportunities around that as well.
Thank you, Ellie. I'm seeing another question about the best and most effective form of help if someone sees someone who is in need of help, who is on the street, especially if there are concerns around personal safety.
So oftentimes we will tell you that your personal safety is the most important of it all. And it's whatever you feel comfortable to do. Helping somebody that is in a situation like that does not mean that you have to administer the Narcan and naloxone yourself. What you can do to help is call 911. You can call for police. You have to ensure that you are safe and you feel comfortable doing that. And that is all you have to do. Your personal safety is most important at the end of the day.
Very important. Thank you.
So I see in the chat that someone had mentioned the Good Samaritan law. Our stance on that is that we really encourage you to reach out to your local resources, reach out to and find out how those laws are working and implemented in your community. So please reach out to your local RCMP or city police, anyone that you think could speak to that particular, because we are a national organization, it becomes very difficult for us to really speak towards these laws, knowing that every province operates slightly different. So I do, again, encourage you to reach out to your local resources to ensure that you are functioning within the guidelines of the Good Samaritan law as seen fit in your community.
Yeah, just the delivery of first aid by lay responders or by bystanders is legislated provincially and territorially. So definitely, yeah, take a look at what is going and how it's going to impact in your region, because it is in the legislation.
Thank you. And just one final question from our audience. How can we better involve families and support systems in our harm reduction efforts?
You can meet people where they are. I'm sorry. You can meet people where they are. You know, not everybody is ready to have the conversation that we're having at the moment. But you meet people where they are and where they need to be. Have a discussion, give them facts. Don't exaggerate. Do things in a very simple way, simple language that everybody can understand. And not everybody is going to get to a place where they're going to know everything about that. And I think that like that's a good starting place for where families can support each other.
I would just say that it was a question more around how families can support each other when they've got someone in their life who is dependent on an opioid of some kind, or how families can be more involved in the process of helping that person. I think in either way, it's about creating those safe spaces for families to gather. It's about creating education and not being afraid to have conversations, even if it's in different terms, with children and youth around it as well, so that they understand what that is. They understand how they can help when that person may be in their life as well. It isn't just adults who can help as well. So it's understanding that children don't have to necessarily be completely sheltered, just maybe shown in a different way how they can help this person who may be going through this process.
Thank you. And I just wanted to check with our facilitators if there were any last comments before we wrapped up. Thank you so much, everybody, for joining us today. And so we're going to move to our roundtable at our separate Zoom link. It's on the screen, and you can just go to purl.redcross.ca/OHR roundtable. And the passcode is 00000, just 5 zeros. So we will see folks shortly at that link. And I'm just going to close up here. Thank you so much again, everyone. See you on the other link.